I've been taking the same amount of levothyroxine for 10 years. And I started feeling bad it's been about a month ago. And my heart rate kept jumping up and stuff, and I couldn't figure out what was wrong. And I felt like I drank about 13 cups of coffee. And I thought, I remember reading something about that. So I looked it up and it called it hyperthyroidism. So I just stopped taking the medicine. I called my doctor and he told me to come in. They did blood work and he told me don't take it anymore. And I said, why? And he said, well, evidently it grew back. I don't know.
That is, listen, this is not the first time that we hear this testimony. When we came into Lifewave, about 2 months later, there was a lady writing out her testimony, and she had very similar, actually the same testimony as you. She was on thyroid medication for about 20 years, long time, all her life almost, right? Half her life. And when she started on X39, she was actually wearing it right here. And I want to say it was X39, but now I don't remember exactly what it was. She was wearing X39 and some patch right here. Yeah. And then she started the same symptoms of hyperthyroidism. And she was even taken to emergency room. So she was thinking the patches are not working and she's getting worse. And they did all the testing and they said, we need to take you off your medication. Your thyroid was awakened. It started working.
Yeah,
so
I was
X39.
I was amazed because I know it generates stem cells and they grow organs with stem cells. Yeah. So evidently, I don't know. My doctor's really confused right now. He's having a hard time dealing with it.
Yes. Well, that's a great news. And that's how 95% people are. There is 5% or 3%, actually, it's 97% of people that have amazing testimonies, that have better lives. There is 3% that I, noticed that don't have testimonies, or maybe they do, but they just didn't notice or don't know because they had no blood test, no testing, because these patches work on your internal organs and tissues on things that you might not be aware of.
Right.
So
I didn't know this was growing back.
That's amazing. That is so beautiful. Thank you so much, Ron. Now I'd like to go to Sister Darnell.
All right, Sister Darnell, wake up, girl.
I'm here. Hello.
There she is. Hang on, whoop, lost you. Hang on, let me find you again.
Yeah.
Where'd she go?
Oh, we lost you.
I'm waiting. Hello.
I know, but I gotta figure it out. Let's see. Oh, wait a minute. I think I saw her.
Okay.
Nope. I did a second ago and then I lost. There she is. All right.
I guess my most recent testimony is the fact that my gums are doing so much better than they had been over the last 35, 40 years. Mm-hmm. So back in February, they had, sent me to have consultation to get a tooth pulled. And I didn't really want to do that. And I had already told my dentist that I was on phototherapy with X39. And, she kind of, you still have inflammation in your gums. So I went back last week in June, and she was amazed at how much better my gums are. And they're no longer talking about pulling that tooth. And I can feel when I brush my teeth that it doesn't wiggle anymore. So I think on the horizon, they are going to start talking about bone growth. Mm-hmm. Because I believe that is exactly what happened between the two x-rays that were taken last year and this year.
That you told me about that, and that was also the second time I heard similar testimony. Mm-hmm. There was one testimony before you that had a very good gums testimony, that inflammation went down. So with that, when you pointed to stem cells building bone, I want to speak about X39 a little bit, which, I am not saying you have to get X39. X39 is a systemic patch. It works also on bones and muscles as on any other tissues and organs. It is systemic, by the way, as I said, but X49 is specifically for bone growth and muscle growth.
I wear the bundle.
You do. So,
Yes.
okay, so maybe that's why. Because David Schmidt, I listened to several of his interviews and his speeches, and it was very impressive to listen about X49 scientifically, because it specifically builds bones, and women after menopause have problems with bone loss,
And
osteopenia.
men have all their teeth falling out, so I'm gonna start.
That's
using
right. When you don't
X49.
have teeth, when teeth are going bad, that means your bones are really no good. So basically, X49 is good for osteopenia and osteoporosis, right? And that took my attention because that's very important. And I know that the progesterone cream, natural progesterone cream, builds bones as well. So that's what I always recommend for women after menopause, to have bioidentical progesterone cream. But then there is this patch SP6 that Lifewave has, that if you wear that actually balances out the hormonal production in the body systemically as well. And sometimes when women use SP6 patch, they don't have to take bioidentical hormones anymore. So this is quite amazing how all of this works. But before we end, I do want to say one thing. Be careful with patches, how you store them, okay? If they seem not to work, be careful that they were not on a hot sun too long. Like when they were delivered and they were maybe on a hot sun for 2 days, that you were out of town and they were out there and they got really, really hot. Or that you have them stored somewhere close to the body, like you wear them in purse and you wear the purse and it's close to your body, because remember, they get activated by the body heat. Okay, so what happens that they all get activated, and then also sun, they get activated by sun as well. So they all can get activated and they're working there, and then they get deactivated after several days. So be careful to store them away from the body. Be careful so we don't have them somewhere on a table where a cat or dog can sit on them, because they will get activated by the heat of a cat's or a dog's body as well. So as soon as you get them, put them to a nice colder environment where there is air conditioning, and put them to the cabinet somewhere. You go in the morning, take one out quickly and put it back away from the body, okay? So that's very important.
Real quick before we leave, Suzanne, can you share your testimony? My wife was not here when you shared it before, because I know you've had some nice results as well.
Well,
Was
I
it-
don't, I'm not sure what you're.
May have, no, you know what it is? I know what it was. We were doing a question is what it was. Who was it that had that? So anybody else, let me ask this, anybody else have a testimony before we log out?
I have
I
one I
have-
want
I
to chime
do.
in. Oh, shoot.
Where you at?
I have a
I don't-
testimony.
Where
ahead.
you at? Who is it? Scott, is that you?
Yes.
Yeah,
Yeah.
we talked today, right?
Okay,
It's-
Scott, yes, hang on, Scott, let me get you up here.
Okay.
All right, go ahead, brother.
Okay. Well, I heard about X39 on John's show, John Moore radio show, and I thought, oh, good grief, what's he selling now? And I thought, what's this now? Oh my God. I was used to Leon Green and his essential oils, so for years I was listening to that, and I know Leon. Anyhow, I bought it, tried it out, and I've used it for about 4 months. And I went to the doctor about a month ago, and my doctor said to me, I've had high blood pressure for about 15 years now, 10, good 10 years, at least 10. And the lady did my blood pressure, and she said, wow, perfect. I'd never heard that before. I said, what? And she said, yes, it's perfect. And she said, what have you been doing? Jogging or something? I said, no, I haven't. And I told her about X39. But when I was done explaining to her what I have heard from the show, she was interested. She left the room. She came back in and she wrote it down, Lifewave X39, yeah, my number. And then she left the room. The doctor came in and he said, yeah, we're looking at your blood work there. What have you been doing? I go, and I showed him the patch on my neck. And he said, what? And I told him X39, yada, yada. And he said, yeah, you were pre-diabetic. You're not anymore. I'm like, well, that's good.
Yeah.
And then, so now he wants to, he wrote it all down. He's looking into it for himself too, because he's not getting any younger. I went to see my eye doctor, and this is why I got an X39 for my eyes. I went to see my eye doctor a week ago, and I have his paperwork right here. I'll read. He wrote down here. He was dumbfounded because my right eye, I've been almost blind in my whole life, is very poor vision. And it's the connection between my brain and the eyeball. That connection is very poor. I don't know what the exact medical term is for that, but he when he had me reading with those big goggles where he's closing this eye off and he's turning the dials on this one. I usually read like 3 letters, the E, the big one, and 2 underneath it. And that's about as far as I get with the right eye. But then I went to the third line and I was like, P? And he's like, oh, very good. L? Oh, yes, there is an L up there. Oh, he goes, very good. And he figured I was done. And then I go, M? I started reading the next line. And he's like, what? And he's looking at me with his jaw on the floor. And he's like, and I start reading the next line. I go, is that a T? Yes, that's a T. And he just sat back like this. And I just kept reading with an eye that I haven't used hardly at all in my whole life. And so my prescription changed just after 4 months. It says my right eye went from 20/80 to 20/60, and my left eye went from 20/30 to 20/20. So, and he's changing my prescription. He wrote down some other information here for me, but he was flabbergasted. And of course, he wants to know all about Lifewave. And I was explaining it to him, and he just couldn't believe it. I told him that I heard Steve say that Steve was a 500 prescription, then he went down to 250 roughly in astigmatism. And he was like, just tilted his head, like, how does that happen? How do eyes get better? You know, I mean, they just give you thicker glasses, I thought. So yes, that's what I always thought. I'm 58, and I'm real happy with it. My energy level went up, but I think one time I did have my X39 in the windshield, just like Yana was saying, for maybe a half an hour, and they got a little warm. I thought, oh boy, I hope that didn't affect them, and it probably did. So I guard them more now, because that is important. They're not cheap, so you want to get your best effects out of them. But
Yeah.
I have a question. Would I be able to wear an X39 on the side of my head, right by one of my eyes? Would that be okay, or should it be on the C7?
Well, I will tell you how what David Schmidt recommends, what company recommends, and what people are saying. Okay, so
Well, he even said in the meeting recently, he said when we did the test, we did C7 and right below the navel. He said, but theoretically, he said, you can place it anywhere on the body and it'll still work.
yes. So the reason that they show you C7 on the neck and below navel is because that's how they did clinical studies. That's how they proved that it works. So that's what they put in the literature, that this is how you wear it. That's a recommendation. It works for people. I wear it that way too. But many people, when they have certain troubles, they want to put that patch close to where the trouble area is. And they have been doing that, and it still works for them. So I guess you could brother, you could do that.
I have wore one on the temple once before, just out of curiosity.
Sometimes I
The,
put it
the
in here because I put so many patches on me that I have no place, so I just put it here. It still seems to work. Yeah,
the sleepy poo patch, you can put it here or on the side of your eye here or back here. There's a lot of places for that. That was why I was wondering if you could put the X39 there.
Yes,
But
it's normally
Huh.
wherever the energy that flows through the body is where the patches work good at. But
Yes.
two,
Okay.
when you put them closer to those troubled areas, I did it on my lower back for a while, and it actually got rid of the biggest part of the pain in my lower back by wearing it
Mhm.
there.
Just don't ever wear X39 with Alavida together. They
Wow.
somehow
Don't do that.
cancel, not Alavida X39. That's why X39 is more of a day patch. Don't, it's not a night patch. I do have one lady that likes it at night. So it's all subjective, I guess. But yes, but it is usually a day patch. So I recommend it during the day, especially because a lot of people get energy from it. So you don't want that energy at night when you need to sleep. But Alavida frequencies with the X39 kind of tend to cancel each other out. So don't wear them together. Alavida should be a night patch, actually. If you have
Alavita's for your skin. Is that correct?
it is for the skin, but I have done more deeper research on it, and I want to do a special video on this because it is actually prolonging telomeres. I will do a special video on this. I have just
Okay.
done recently a study into Alavida and what it does, and it's more than just skin and more than just wrinkles of skin. It literally rebuilds collagen. It literally rebuilds the health of entire skin and thickness. So yes,
Oh,
Alavida is a skin patch.
elasticity.
Yeah,
What-
elasticity, the whole health and collagen. It's such a great skin patch. So I wear it. I wear it here every night. I put it right here.
Oh, and that the skin is the epidermis is the largest organ of the body.
It is. It is,
Yes.
and it's also it gets some things in, right? Like it absorbs
Yeah.
things, so you can absorb a lot of things through skin. It's a very important organ, so we should take
Oh.
care of skin. Mhm.
Yeah, do you
Yes.
do the whole system for Alavida?
I do, and I am not on beauty creams, and I was never a lady that wanted these special creams and all of that kind of stuff. I will tell you, just regular virgin coconut oil is the best for your skin, right? Whatever you can eat, that's what you put on your skin. However, I started using Alavida. No, I use patch every night. That's just, Steve can tell you, it goes right here as I go to bed. But I started using their skin products as well. And I do it because they're 98% all from nature. I looked up what's in them. They're very safe, very good, and I like to smell. So I said, hey, I'm just going to support the company. I have to put something on my face anyway. Why not to do Alavida, right? The whole skincare. So I am doing it myself, yes.
I do have a small testimonial.
Okay.
Yes,
On the X39 patch for 6 months now. And I have many health issues, so I really don't know what it is addressing. But one very noticeable thing for me is my gums are just really healthy and fine, and they weren't. So I'm very pleased with that.
And that's, you see, Darnell, this is quite common benefit, gums, and that's amazing. And when you have a lot of issues in your body, just think of how many years it took you to
Oh, I know.
those
I know.
issues, right? So
Yeah.
just be very patient and wear this patch every day. It's part of my life now. I would not be at this time and age, I would not be without this patch because I know that stem cells are the medicine of the future.
Oh,
In fact, I'm doing a lot of, and believe me, I really pray that David Schmidt and his team and scientists that are for humanity, they will keep making it better, keep refining it, because our stem cell is what makes our organs.
right.
That's what creates our new organs when we are in utero, and when anything is getting fixed, clinics are injecting stem cells from
Mhm.
other people or from placentas, and I don't trust that when it's somebody else's stem cells. That has also ethical issues, right? But when it's your own stem cells, God
Right.
gave those stem cells for a reason, and for whatever reason, we are losing by the age 35, we have already 50% of them inactive.
Mm.
This is why aging happens. So this technology that just by light, frequency of near infrared light, is able to reactivate, rejuvenate our stem cells, I think that this is something we should definitely have as part of our life.
Yep.
So, yes.